Hi and welcome to this video update from the Community Wellbeing stream of the Hazelwood Health Study. We want to update you about the findings of our research on social media use during the Hazelwood mine fire of February and March 2014. I'm Dr. Sue Yell and I'm the lead researcher for the media component of the Community Wellbeing stream.
And I'm Dr. Larissa Walker, Research Assistant for this component. We're located at the Gippsland campus of Federation University here in Churchill.
We studied social media because it provides valuable insights into the way the community experienced the event.
It also has a broader significance for other communities experiencing a disaster and how the communications environment impacts on this. Part of the context of our research are the criticisms of official communication during the mine fire. The state government set up the Hazelwood mine fire inquiry in response to concern over how the event was handled. The inquiry found that there were significant shortcomings by government authorities in communicating throughout the emergency.
The Hazelwood disaster has been the focus of international research. In 2014, a study was conducted comparing the use of social media during the Hazelwood mine fire with its use following the 2008 Sichuan earthquake. The research found that in both disasters, social media were used for a common set of purposes.
Other researchers have identified that social media can play a role in reducing risk during a disaster and in responding to a crisis. Our research builds on this by showing in more detail how the community perceived official communications during the fire and how community members used social media to address shortcomings in the official communication.
Our study will help authorities involved in managing disasters to develop better communication strategies. In turn, this will help build trust between authorities and the community. Although the community were using a range of social media, including Twitter, Instagram and Facebook, we chose to focus on 3 community-driven Facebook groups that were specifically posting around the fire and smoke event. These were The Air That We Breathe, Voices of the Valley and Occupy Latrobe. We analysed the activity on these Facebook sites as well as interviewing their site administrators. We also interviewed local journalists regarding their experience of broader communications during the fire. Our analysis covered the 45 days the fire was active and summarised the key themes.
While we're aware that these 3 Facebook groups don't represent the views of the entire population, they do provide a useful case study to show how social media can be used during a crisis. We're going to show you some word clouds to give you a visual snapshot of the kinds of topics identified and discussed by community members who are active on these Facebook sites.
On the Air That We Breathe Facebook, the main themes included health risks, the role of government and other organisations, the smoke and air quality, and gaining media attention for the crisis.
Prominent themes on Occupy Latrobe Facebook were the health of the community, safety issues, the clean-up effort and public anger.
On Voices of the Valley Facebook, health concerns were also prominent, as was the lack of information and the role of organisations involved in the emergency response.
There was a lot of consistency in the themes across all 3 groups, as you can see in this final word cloud.
A key theme to come from our research was the close relationship between information and trust. Our analysis shows significant issues around which organisations and which information sources were trusted.
We know from previous research that people trust those they know, and that disaster communication should preferably come from as local a source as possible.
One message that came through overwhelmingly was that those expected by the community to provide accurate and timely information about the health impacts of the smoke event did not do so. The community queried and challenged information from key organisations such as the Department of Health and the EPA. Some information was contradictory and conflicted with people's direct experience. Silence or gaps in communication from authorities on important matters further fuelled suspicion and lack of trust. The community used social media to share first-hand experience of the event, but unlike other types of disasters such as floods, where eyewitnesses can directly observe and report river heights or which roads are flooded, information on smoke pollution is more dependent on experts. This makes community observations and reports more difficult to substantiate.
Due to gaps in official communication, people posted and shared a wide range of information that they found online, particularly information on the health impacts of the smoke. Yet many of these information sources are not subject to the forms of gatekeeping which exist in professional mainstream media and may be inaccurate. The social media administrators we interviewed said that they faced difficulties deciding when to post information in case it could not be verified.
Another theme to come out of our study was the key role of social media in community empowerment and engagement. Social media can have both positive and negative impacts on the community's relations with one another and also with the authorities responding to a crisis.
An important role social media groups had during the crisis was bringing the event to the attention of the mainstream media. However, disagreements did occur over who could speak for the community and whose experiences were real, true and representative.
One point of conflict was over whether it was okay to criticise the emergency response by authorities. Some in the community saw criticism as whinging and thought it would just intensify a negative perception of the local area.
The relative intimacy of social media means that members of the community can feel more comfortable speaking out, particularly when some people wouldn't feel comfortable going to the mainstream media with their concerns. As a result, community members affected by the Hazelwood mine fire have become better at speaking out more and have discovered that they have a voice that is listened to.
Social media also became a forum for community empowerment. These Facebook sites showed community members coming together to take on important roles themselves, such as advocacy and information sharing. Social media fulfilled a watchdog role, holding the authorities to account. They enabled community members to come together to assist with community rebuilding and resilience.
Social media can provide an important space for communities to express their perceptions of a disaster and how it's being managed.
Our research shows that social media play a complex role during a disaster. People turn to them when they don't trust the information they're receiving from the authorities or when they want to share what they know.
Social media can fill an information gap, but it can also sometimes confuse rather than inform. They can empower communities, but they can't always overcome existing divisions.
Positive impacts of social media depend on developing good relationships, trustworthy information, strong partnerships in the offline world, and follow-up action. We aim to use the knowledge gained in our research to improve communication in the hopefully unlikely event of a similar crisis in the future. Both the literature and our interviews stress the importance of timely and accurate communication through multiple channels.
In the next phase of our study, we want to look at the principles for optimal communication during this kind of event. This will be provided to key organisations to help inform and improve their crisis communication policies.
We look forward to updating you in future as our research unfolds.
Thanks for watching.